hard to go, and some patients, because of the nature of where they live, it is just not possible for them to come forward either to meet us or to come to facilities they regularly come to collect those medications. But now that is over.
Dr. Gumel, what's the relationship between HIV/AIDS and COVID-19, given the fact that the two seem to be going the same way?
So, if I can say in a simple way, HIV is a chronic disease. HIV doesn't kill. COVID is a disease that when it comes in, it's an emergency, especially if it is symptomatic, and if care is not taken, it kills immediately. HIV, if somebody dies from HIV, he virtually dies from complications of HIV, but not directly from the virus itself. So that is, in a simple way, the difference between the two. This one takes longer. It can stay with somebody for as long as that person lives. People have been staying with HIV now for 30 years, some of them for 20 years, and they are still looking healthy. They are still looking like fresh tomatoes. Nothing happens to them, and you cannot read it in their face. Somebody cannot have COVID and become symptomatic COVID, and to the extent that that person is admitted to the hospital and goes to the emergency to talk the same story. If that person survives, you don't see it again. But if unfortunately that person does not survive, becomes a victim or casualty of COVID.
Well, in terms of treatment, the relationship may be close, given the fact that drugs used by HIV patients are being rather hijacked, in quotes, by COVID-19, patients. Is that true? And if it's true, how have you been managing the situation?
To some extent, that was true a couple of weeks back when there were no evidence that these drugs actually were impactful in terms of COVID treatment. And now it is clear that those drugs, are not as impactful as they were thought to be, and as such, they were not advised to be used. Because of that, we had to switch, especially our patients that are on second line, from the popular drug we use here in this country, Calitra, to Atazanava, which is a bit more expensive, and that is at the expense of HIV financing in the country. But that's over.
So what's Nigeria doing, therefore, to meet the 90-90-90 target, as you put it?
So if you look at the theme of this year's conference, is resilience. Okay, so Nigeria is resilient in terms of the way we are matching ourselves towards meeting 90-90-90. We are matching with every effort we have, and with all our program partners and the implementing partners and the effort they have been putting for the last 15 years. Last year, after NICE was launched, the result, Mr. President asked us to go for the last mile. And now that's where we are. We are marching for the last mile. And we are doing everything possible to contain and control HIV/AIDS and to meet those targets 90-90-90 in the next 3 years.
When you say 90-90-90, some of us may get to know this, but a lot of people will start looking at them as figures. What is 90-90-90, at least lastly?
90-90-90 means 90% of people that live with HIV. Let me give an example, Nigeria. 90% of people that live with HIV or have HIV in Nigeria should know they have HIV. That is one. And this is possible with testing. And 90% of people who know they have HIV should have access to antiretroviral drugs, the drugs that do the magic, in terms of treating HIV. And 90% of those who have access to those drugs that do the magic should be able to contain the virus in such a way that, one, the virus does not kill them or does not give them that bad look, and at the same time, the virus does not leave them to go to other people, to infect other people. So essentially, if the virus is contained within individuals that have the virus, the spread or new infection is going to drop, and if we succeed in containing new infection, we are marching our way forward to stopping AIDS and eliminating AIDS and stopping AIDS days.
Dr. Gumel Aliyu, thank you so much for sharing your thoughts with us.
My pleasure.
Thank you. Now, moving on now, the Chairman Presidential Task Force, Boss Mustafa, has urged Nigerians to remain vigilant and responsible despite the ease of lockdown as COVID-19 does not respect relaxations Boss Mustafa said this during the PTF briefing. He said the decision for further relaxation was cautiously taken by government to balance lives and livelihood, and the situation in Beijing and United States of America should guide individual and collective actions, just as the Minister of Aviation has released protocols for resumption of domestic flights and embarked on public sensitization.
This morning, the Presidential Task Force met with the heads of security and defense agencies to review and chart a refined course in view of the fact that COVID-19 is a global health and socio-economic and security issue, and Nigeria must continue to evolve new strategies peculiar to her environment, even while working within global prescriptions.
Minister of Health and other members of the PTF say eligible hospitals nationwide are to become sample collection centers, while all tiers of government should plan for the best and prepare for the worst with regard to the pandemic. They said infection rate among health workers has reduced significantly due to training.
Government, through the NCDC, has launched an e-learning platform on infection prevention and control for healthcare workers. We urge them to utilize it, but we shall also refocus on training states with high health worker infection rates.
Today we are announcing and launching new guidelines for the conducting of elections during the COVID-19 outbreak in Nigeria.
The two airports involved that will start, Lagos and Abuja, have passed our tests and they have been approved for operations. That will enforce and make sure that passengers remain obedient and wearing their masks.
Say testing for COVID-19 is free in government hospitals, and anyone demanding payment should be reported. India is now third worst infected with COVID-19 in the world after it records 23,000 new cases as Pakistan Health Minister tests positive that is for COVID-19. And Ebola Brooklyn Sunday has these and more on Global Update.
Saudi Arabia authority says Muslim pilgrims at this year's Hajj must wear face masks at all times, while workers will ensure no overcrowding or gatherings take place during the pilgrimage. The nation's Center for Disease Prevention and Control also listed as preventive measures physical distancing, people will not be allowed to touch the Kaaba, no sharing of personal items such as clothes, phones and toys. The kingdom has the highest number of confirmed COVID-19 cases in the Arab world, with more than 200,000 infections. India has reported more than 23,000 new cases of coronavirus in 24 hours, overtaking Russia to become the third country with highest number of coronavirus cases in the world. The caseload is about 8 times that of China, which has a similar population size. And Pakistani Health Minister Zafar Mirza said he has tested positive for COVID-19. The minister disclosed this on his Twitter handle, explaining that he has isolated himself at home and taken all precautions. At about 7 p.m. local time, the number of confirmed COVID-19 cases globally now stands at 11,630,803. 538,177 deaths, while 6,579,999 persons have recovered from the virus. The Nigeria Center for Disease Control also reported 28,711 as the total positive cases of COVID-19 in the country, 645 deaths and 11,665 recoveries. I am Adebola, Brooklyn Sunday.
Many thanks, Adebola. You're watching the news on NTA International. We'll now take a break. Stay with us for more.
The incessant reports of rape and sexual offenses in recent times is indeed worrisome. Are you a victim? It may be rape, incest, sexual abuse or sodomy. I have good news for you. NACTIP implements the Violence Against Persons Prohibition Act, and we now have the National Sexual Offenders Register, which records the names of all perpetrators. This register aims to name and shame all perpetrators to serve as a deterrent. If you are a victim, seek help now, and we assure you that justice will be served.
Register sexual abuse cases and perpetrators on www.nsod.naptip.gov.ng or call the Sexual Offenders Register hotline on 0703 0000 203 or NAPTIP hotlines on 0803 220 3462, 0818 384 6635, social media platforms and iReport app. This message is brought to you by NAPTIP with support from ROLAC, funded by the European Union.
Well, thank you for being there. The completion of Abuja Steel Company, which was temporarily interrupted by COVID-19, will soon commence. The Minister of Mines and Steel Development, Olamilekan Adegbite, stated this in Abuja. Mia Oyede reports on this and COVID-19 plans for the sector.
Abuja Steel Company has seen a lot in its over 40 years journey, regrettably still in incubation. But when the federal government shows commitment for its delivery through partnership with the government of Russia, COVID-19 struck.
Just before the pandemic set in, we were to host the Russian experts who are coming in to do the technical audit of Ajaokuta and of course of Neomco in Itape. But of course, this is in abeyance until the pandemic or the lockdown, especially on air travel, international travel, is lifted. Everything that is required in Ajaokuta and Neomco that's obtainable in Nigeria must be sourced from Nigeria.
Ajaokuta Steel Company still invoking unimaginable sympathy, and the federal government is also willing to complete it. But that does not take away the attention given to other segments of the mining value chain by the federal government. 2.3 trillion naira post-COVID-19 intervention fund released by the federal government, and the Ministry of Mines and Steel Development gets 6 billion naira from it.
We intend to spend this fund and some other funds that are available to us, helping to improve artisanal mining projects in Nigeria, people that are involved. Also, helping to deepen our explorative projects. We should be able to launch our new cadastral system, the EMC.
Illegal miners arrested early this year are set for trial, the mines minister assured. Mie Ogede, NTA News.
Well, many thanks, Mie. Now let's talk about politics. All Progressives Congress National Campaign Council for the 2020 Edo State Governorship election has been inaugurated. Chairman, Caretaker and Extraordinary National Convention Planning Committee, Maimala Buni, also inaugurated the party's Edo and Ondo State Reconciliation Committees. Salih Abdullahi reports.
According to the guideline released by the Independent National Electoral Commission, in line with Section 99, Subsection 1 of the Electoral Act 2010 as amended, campaign in public by political parties in Edo State shall commence on the 21st June 2020. In view of this, and in line with COVID-19 protocol, only the chairmen and secretaries of the committees have been inaugurated on behalf of members. In their terms of reference, the reconciliation committees are to reach out to relevant stakeholders in Edo and Ondo and practically demonstrate the party's plans initiated to rebuild confidence and recover its glory among supporters and Nigerians. While the task before the high-level National Campaign Council for the Edo State governorship election, as highlighted by the caretaker chairman Maimala Buni, is to go for victory.
I'm glad to state that the caretaker committee, which I am opportune to lead, had initiated a wide range of consultations. We are committed to rebuilding confidence and trust, recover the glory and political fortunes of the party in all the states across the country.
Chairman of Edo Governorship Campaign Council of APC, Governor of Kano State, Abdullahi Umar Gandoji, said the committee has the capacity to deliver and retain Edo State in the Progressives family.
The main purpose of this committee is to provide an enabling environment for all our party men and even non-party men, members of the public, to appreciate our party based on their conscience and based on their ideological belief that APC is the answer in Edo State.
So what we're just going to get there to do is to make sure that we bring everybody together and we focus on competence of people that will be representing the party in the coming elections.
And it's normal to have a misunderstanding, but at the end of the day, I can assure you will be able to reconcile the problem of the party.
Other members of the committees present at the event are governors of Kogi, Lagos and Gombe State, including a former Senate President, Ken Nnamani. In Abuja, Salihu Abdullahi, NTA News.
President Muhammadu Buhari has joined the All Progressives Congress APC in grief over the passing of its former member of the National Working Committee, Inua Abdulkadir, who served as Vice Chairman Northwest. In a statement signed by a special advisor to the President, Media and Publicity, President Buhari condoles with family members, friends and political associates of the party's stalwart who served the country as Minister of Sports and Youth Development and played a prominent role in the creation and sustenance of the party. The President believes Abdulkadir's humility, maturity and penchant for facilitating reconciliation among members will be sorely missed at a time the party is rebuilding and repositioning to deliver on its promises. President Buhari prays that the Almighty God will receive the soul of the departed and comfort his family. In a similar development, All Progressives Congress has expressed deep sadness over the death of its immediate past National Vice Chairman Northwest, Inua Abdulkadir. The party, in a statement by its Deputy National Publicity Secretary, Kini Nabena, said until his death, Inua Abdulkadir was also the Chairman, Governing Board of the National Agency for Food and Drug Administration and Control and Chairman, Governing Council of Sokoto State University, as well as former Attorney General of Sokoto State and Minister of Youth and Sports Development. The APC said it has lost a grassroots politician through progressive and distinguished personality who served the party and country meritoriously and at the highest level, and prayed Almighty Allah be merciful and grant him Al-Jannah Firdaus. And we thank you so very much for watching the news on NTA International. I am Yusuf Dada Busman. Bye-bye.
www.nta.ng. For live streaming, visit www.nta.ng/live. Now, you can stay updated on the go, be it on your TV, iPhone, laptop or iPad, or download the NTA mobile application from your Play Store or App Store. NTA, you can beat the rich.
24 hours a day, 7 days a week. You can watch NTA International live on your TV, computer, iPad, tablet and phone. Log on to visiontv.co.uk and click on Entertainment, then NTAI. You can also download the iOS or Android app on your mobile devices to watch NTA International on the go, anywhere in the world. NTA International, your window to the world.
Want access to all your favorite local and international shows wherever you go? Here's how. Head to showmax.com and click try for free for 14 days. Enter your email and create password. Choose your plan and payment method that suits you and start watching. You just opened up a whole new world of non-stop entertainment. Stream online or download the Showmax app to watch on your mobile or tablet, anywhere, anytime. Visit showmax.com now.
catch them young and watch them grow is probably the phrase that best describes